So I am joined by Dr. Ozdemir, who is in a very beautiful Cyprus right now. It's beautiful.
Yes, yes, indeed. It's very beautiful.
Oh,
Sunny and lovely, blue sea. Nice. Everywhere is nice here.
and you can see the sea from your... Are you at home at the moment?
Directly.
Oh my gosh.
I'm living directly at the seaside. This is nice.
Hugely envious.
But we have thousands of English people here, you know? They're living since 15, 20 years in England. After retirement, I think they came here. They settled down and they're expats, or not expat,
Yeah.
but
Yes, yeah.
yeah.
One day I will visit. But you are a doctor
Yeah.
for IVF Turkey, aren't you?
Yes, I am. Yes, I am.
And so today you've let me steal you away for a little bit so that I can ask you some questions about egg donation.
All right. Yes, please.
I thought we'd start by just, if you could just explain to us egg donation. What is the procedure of egg donation?
Let me start to explain what egg donation is. Actually, egg donation is using the eggs from donor women. Taken, the eggs are taken from her, and we call these people donor, and used by the patients who entered menopause already, or early menopause perhaps, or who are unable to achieve a healthy pregnancy with their own eggs, and we use this egg donation. We call this cases egg donation, IVF cases. Yeah, we use this donor eggs.
And what is the difference between IVF with your own eggs and IVF with donor?
What is the difference? And actually, there's not a big difference, really, for us, for doctors and for nurses, or for laboratory personnel, for embryologists. I mean, in normal IVF treatment, we use various hormones to injections are given to the patient to make the follicles, or to how can I say, for development of the egg cells. In egg donation, we do this process by the donor. It is the same, actually. We don't collect the eggs from the patient herself. We collect the eggs with some hormone injections after 8 or 10 days of injections, hormone therapy time, and we collect the eggs from the donor patient. It is the same, actually, but we take these eggs and fertilize with her husbands, with recipients, patients' husbands' sperms, and we obtain the embryos. After 3 days or 5 days, we transfer these embryos to these recipient patients. Not in IVF cycles, you know, we take the eggs, we fertilize them with the sperms, and we perform the embryo transfer to the same patients. It is it is only one difference.
And the woman who is then going to have those embryos put back in,
yeah,
what do you do to prepare her for that embryo?
Yeah, we prepare her approximately 13, 14 days till embryo transfer day with some estrogen tablets for thickening of the endometrium, so-called, how do you say, uterine lining. Yes. For proliferation in Latin, we say Latin proliferation. This is the thickening of the three-laminar, three-layer of the endometrial lining, uterine lining. And if this lining is over 7.5 millimeters, that means the patient is ready for the embryo transfer, and we can perform the embryo transfer.
Wow. So is that the only treatment the woman or the recipient of that embryo, is that all she does then in terms of medication? It's medication to prepare her lining?
Yeah, it is actually we can give some it is not evidence-based, but we are giving, everybody gives in the world mostly, some low-dose aspirin tablets, baby aspirin tablets, the acetylsalicylates, and some vitamins, some omega-3 tablets, some folates, folic acids. These are the complementary therapies, so to speak. But I mean, the most important therapy is the estrogen tablets, estrogen hormone tablets. It is the only thing which thickens the endometrium and the uterine lining. And so, the other hand,
I know I'm sort of going off a little bit here, but do you also test progesterone levels? Because I know
yes, of course.
Do you? Because I keep hearing that some women keep telling me that they haven't been testing their progesterone levels.
Oh yes. When the patient visits us at the first time, we look all hormone. How can I say hormones? Estrogens, progesterones, prolactin, some androgens, also some testosterone or dihydroepiandrosterone sulfate, and TSH, thyroid hormones, of course. But progesterone hormone is very important at the 21st day of the cycle.
Yeah.
Beginning to rising.
Yeah.
But at the beginning of the cycle, on the second or third day of the therapy, we measure progesterone hormone also. If it is too high for the beginning of the period, too high means more than 1.5 or 2. We don't begin with the cycle, with the therapy. We cancel it or we postpone it for the next cycle. If the progesterone hormone is from the beginning on is high, it is not good for the, how can you say, expectation. I'm a positive results. That means pregnancy.
Yes. And can I just ask, going back to the bit before creating an embryo, are the donor eggs, do you use fresh or frozen donor eggs?
Mostly, over 90% we use fresh eggs, of course. It is the best. We have better results actually. 80, sometimes 85% of pregnancy when the donor has good eggs, healthy and mature eggs, and fresh eggs. Of course, because of the pandemics in last year, we had some problems to bring the patient to the islands, to Cyprus, because of airplanes, because of pandemics, because of quarantine time here in Cyprus. Sometimes we collect the eggs, but we cannot match the egg collection day and the sperm giving day of the husband. Sometimes we collect the eggs and we store it with cryopreservation. Yes, we freeze it and waiting for the patient. Sometimes, but it is rarely actually. But we don't use, preferably and principally, no frozen eggs.
Yes, okay.
It is better to use the fresh eggs.
Okay, and can I just talk to you about that conversation that you have with a patient when you say to your patient, I really think egg donation is the only way forward for you. Is that a difficult conversation?
Sometimes, yes. Sometimes, yes. Some patients are very clear about that and more educated, more open-minded. You know, you can explain the situation to them better or easier. But some patients don't want to understand the situation. Or some patients don't want to hear about it.
Yes.
even you cannot offer some patient.
I
Egg donation?
yes.
Oh, for God's sake, never. For example, you have the reaction sometimes from the ladies, from the women. But it is, we have to choose the words very carefully. And it is not our job, actually, you know, to insist on the people on this case, egg donation. It is just an offer.
Yes.
Look, you don't have any more eggs on your ovaries. Your hormones and your ultrasound view is 100%. You cannot have your own child. You cannot get a pregnancy anymore. We can say that, but we have to choose the words very correctly and proper words. We don't want to hurt the people, you know, the women. But it is not our job, as I said, to insist or convince the people to do that, you know. We can just offer. There is an option, and its name is egg donation. If they say, what is egg donation? We can open the case, and this is egg donation. We can explain about whole therapy. So that's it.
Yes.
Perhaps in England, it's also for some colleagues not easy to explain.
Yeah,
and sometimes it's not easy. You are in the menopause. You cannot sometimes you cannot say that easily, you know.
Yeah, I think it's also incredibly hard for young women. I met an amazing young woman a couple of years ago, and she was told that she would never be able to conceive with her own eggs, and she really, her and her partner really struggled with that diagnosis. Really struggled. And so we held a lunch for women and men who were basically told that this was the only route for them. And we invited other parents who had had children through egg donation. And this young girl that I'm talking about said it was only being in that room with those other people that had been through it, doing that changed her perception of egg donation. And she could see past the kind of, you know, the fears, and she saw families, you know, she saw families. And she is now the mother of a beautiful little girl. But it was changing her mindset, she said. She had to change.
Yes, of course. Sometimes the people are thinking of it many months or years even, you know?
Yes.
And sometimes they have hope, even if the hope is 1% or 2%, they are waiting for their own children or own eggs. If at the end, some of them are coming to the idea, I'll do it, of them, no, never accept it.
Yeah.
That's a matter of, I don't know, culture, not culture, but minds, environment.
Yes.
In some different cultures, this is different, of course, the reactions. In some Muslim cultures, perhaps they don't want it so easily. Some beliefs playing role also on it, to decide on this egg donation. Also sperm donation, it's another case for the man. It's sometimes more difficult to accept it for the man, I know that, but it is so.
Yes. And on the I know I just spoke about that young girl. On the flip side, I had an email from a woman recently who is 43.
Yeah.
And I can't remember her exact AMH, but it was quite low. And so she said to me, help me with, put me in touch with a doctor. She said, should I just try one time to see if I can do it without using donor eggs?
Why not? If she, I don't know how was the AMH level. AMH level is very important for us, but on the other hand, more important is the ultrasonographic view. How many eggs she has more? 1, 2, or 3? If she has 1 or 2 eggs, she can still try a normal IVF with her own eggs, and perhaps somebody, a center or doctor can perform a pooling. We call it collect the eggs and collect the eggs again and again, perhaps 3 times or twice or 3 times. And after this pooling, collecting the eggs, and at the end, perhaps 4 or 5 eggs we have, and we fertilize them and freeze the embryo. We use the embryos for the transfer. It is an option for her. If the AMH level is very, very low, and we cannot see any egg, follicular, primordial or antral follicle on the ovaries, of course she should try. And her age is very good, 43, 43. It's a very good, suitable, proper age actually for egg donation. Why not?
Yes.
She can try it.
That's so encouraging. It's really,
yes, of course.
really so nice and encouraging to hear you say, even if you only have a few eggs, you could still, there is a chance.
Yes, of course. Yeah. There is a chance. But she should be with her doctor.
Of course.
I'm just saying that.
Yes, of course. I was very interested what you just said then about the pooling. Is that what you said?
Pooling.
Yeah.
Pooling, yeah.
This is a really naive question, but why, how does it work that you take it in batches?
We take the egg. It's just a normal IVF treatment. If she has 1 or 2 follicles, and if you have the hope, we can develop the eggs and collect the eggs. Over 43, even with her own egg, pregnancy rate is very low.
Yes.
Sometimes 1 to 2%, sometimes 5%, depends on patients, but it is so. We can take the egg, fertilize with sperm, and freeze it. And next month or 2 months later, we can stimulate the eggs again, perhaps with a minimum stimulation, because she has just 1 or 2 follicles. Some schools calls that, some people calls that mini IVF. With some tablets or low dose injections, we can achieve 1 egg again or 2 eggs, and we fertilize them again if they are mature. I don't know. As I said, it depends on the genetic or age of the patient. If we have good mature eggs, and if we can at the end of the cycle fertilize them, as I said, we collect them in the pool, and at the end we have 3 or 4 or 5 embryos to transfer. It is pooling. We can perform sometimes. Actually, I don't like it too much, but there is another option, tandem cycles. That means 1 or 2 or 3 eggs of eggs of the patient, and from the donor also. And we can fertilize all eggs, and at the end we have embryos. We can transfer it. But patient never knows if it was her own embryo or from the donor egg the embryo. It is another option.
Wow.
Yeah.
You doctors are very clever.
But I don't like that, as I said. I don't like it.
Yes. And do you see with the patients that you have treated, Do most people use an anonymous donor, or do you see people using donors that they know, like friends or family?
No. Actually, we never bring them together. We never introduce them to
But
each other.
but
Never.
what I mean is,
If somebody wants, for
if I
example,
use my sister, or
recipient patient says, I have a young sister
yes,
or cousin, can I bring her? Actually, anonymous donor patients are more preferable. Why? I mean, because not during the therapy. Of course, perhaps they think, the people think, genetically it is next to me, you know, my sister's ex, we are from the same family. Perhaps it's somehow right, but not medically, but legal problems. They can have some legal problems in the future. In the future,
yes,
nobody knows after 8 years after delivery, or 10 years or 18 years. Somebody comes to her, or to the child. Look, I'm her mother. I'm your mother. I mean, what's then? I mean, I don't know.
yes,
The people should know it themselves. You know, we can do it, no problem.
Yeah.
If they are agree with that, but the problem probably occurs in the future. They will confront with this problem, and they should have to solve it, you know.
Yes.
Yeah,
But
I mean,
if a patient uses one of your donors, it's completely anonymous then?
yeah, no.
Yeah. So how would somebody choose their donor? Do you have a catalog of donors?
Actually not. We have some donor patients. They apply to us for egg donation, and we examine them in many blood examinations, hepatitis, HIV, and the other chromosomal examinations, and some genetically hereditary diseases if she has in her family, or father's or mother's side, you know, parental or maternal side. If everything is okay, seems to be okay, we can take this this patient as donor, but we don't have any catalog.
But how
there are clinics in the world, they have catalogs, I know. We don't have catalogs.
Well, I couldn't come to
because
you choose. I couldn't choose, like, if I said to you, I want to have my donor egg to come from a woman who has got blonde hair and green eyes, for example.
Oh yes, we can arrange it. We can arrange it with green eyes, blue eyes, white, or recently I took a call from African country. I don't know where was it. They said we are calling from an African country, Nigeria, Ghana. Really, I swear I forgot. I said yes, please. We want an embryo donation. Oh, single women, single ladies. I said okay. How? They say, but especially we are two ladies. We both want blonde and blue eye. I said, really? Are you sure? They said, yes, we want it. Really? I mean, there is no limit with
wow. And did they go ahead?
They didn't come because of the pandemics. I don't know. They didn't come. But we corresponded a couple of times, and they insist on blonde and blue-eyed boys or girls, no difference, but children.
Is that rare?
Sorry?
Is that a rare occasion?
Very rare, yes, yes, very rare, very rare.
I can't imagine.
And normally, everybody wants to have a child. More or less seem to be like her or like his father. Yes.
Right.
Yes, of course. I mean, it was not so exactly similar, we cannot do it, of course, but blood drips, chromosome analysis, and skin color, eye colors, original hair colors.
Yes.
For example, my hair color is not original. It was black. like this. Yeah, it must be. We are arranging this.
Yeah. Okay. And is there a long waiting list?
I couldn't follow you. Sorry.
If I came to your clinic, would I have to wait a long time for a donor?
Yeah. We are first emailing or calling and taking the phenotypes and phenotype properties of the patient or of the husband also. I mean, the woman can be also single mom. I mean, she doesn't need any husband. It is not a. I mean, legally it is not a must. You know, she can come alone without a husband as a single mom candidate. We can do it also. It takes 15, 17, sometimes 18 days.
Yeah. Oh gosh. Okay. So it's very.
I mean, with preparing time. I mean.
Yes. Yes.
From the second or third day of the cycle, we begin with the therapy with tablets to prepare the endometrium, uterine lining.
Yeah.
And at the same time, we are beginning to prepare the follicles, the eggs of the donor, of course. We are doing also, if we want to fresh donors, what we actually want always, we are beginning with both patients' cycles at the same time, simultaneously, in order to bring the egg collection day and to the recipient patient, so 13th or 14th day.
Yeah, it's very exciting. It can happen very quickly.
Yeah, actually, in 1 month, the preparing time is preparation time is 2 weeks, and the operation, collecting, fertilizing, transferring, and at the end of the 4th week, we have the result.
Yes.
This blood results, pregnancy test.
So what, I've just realized I've kept you for way longer than I was supposed to. But if somebody wants to have their treatment with you, what should they do first? Like, as in, how do they get in touch with you? What do they do?
Oh, they call Sarah, and Sarah sent us the patient. I mean, to IVF Turkey.
Yes. Yeah.
Okay. So that's a joke, of course. I mean, they hear sometimes from friends, sometimes relatives. Sometimes they see us in the Instagram or Facebook or Google. I don't know. They Google all the time.
Yes.
And then they see us and they get contact directly.
What I'll do is, when I put this interview out, I'll make sure that I put the contact details underneath. Nice and simple. And can I ask if one day again I can interview you about a different topic as well?
Yeah, of course. About, I mean, gynecology or obstetrics or IVF.
About anything about making babies, basically.
All right. Okay.
Because
why not?
IVF Babble is just all about giving as much information and education to men and women who cannot conceive naturally, basically. So we just want to just give them as much as we can so that people can make really good informed decisions, you know.
Yeah.
And it's something I wish I'd had, because I didn't know any of this before I had my IVF babies. And so just being able to have access to brilliant doctors like you is incredible.
Oh, thank you. Thank you. You're very kind. I will be appreciated, of course, if you will have this opportunity again to speak about another topic, another case. Of course, why not? I'll be appreciated.
Amazing. Yeah. Well, I shall leave you there, and I will see you very soon. Thank you.
So, thank you very much.